Every year, the Australian Healthcare and Hospitals Association honours a person who has contributed to health systems research and health policy making in Australia. And we do this in the name of Dr. Sidney Sachs, who was really one of the leading thinkers in health systems research and health economics. This year, I'm delighted to announce that the honour is being awarded to Vicky Wade. Vicky Wade is a senior cultural lead on the End RHD, Rheumatic Heart Disease program. But prior to that, she worked very closely with the AHHA on a project called the Lighthouse Hospitals Project, which aimed to make a difference in the cardiac care provided to Aboriginal and Torres Strait Islander peoples across Australia. One of the important things to know about Vicky is that she is an Aboriginal person. She's absolutely devoted to improving the health of her people, and she does so as a specialist cardiac nurse. She does so with humility, with grace, and with significant insight into the way we can make the health system better and more equitable for all Australians. So I think AHHA members across the country will agree with me that she is a fabulous choice for the 2019 Sidney Sachs Medal.
The Sidney Sachs Medal is awarded annually by the Australian Healthcare and Hospital Association to an individual who's made an outstanding contribution to the development and improvement of the Australian healthcare system. Dr. Sidney Sachs was an outstanding leader in Australian healthcare policy, development and public health research over a period of 40 years. And not only that, he was also one of humanity's true gentlemen, and for that Australia benefited. Dr. Sachs made what is probably the greatest contribution to the Australian health sector and Australian public with the development of Medibank, the predecessor of Medicare. Dr. Sachs also established and led the Hospital and Health Service Commission from 1972 through to 1978. So tonight's recipient of the medal that bears Dr. Sachs' name has also made an outstanding contribution to Australia's health service, and like Sid, has done so in a consultative and respectful but influential way. The 2019 Sidney Sachs medalist is Vicky Wade. She taught the Lighthouse team much, including how to slow down and how to be present. And I'd like to invite Dr. Rob Grenfield from CSIRO, who was previously the National Director of the Cardiovascular Health Team with the Heart Foundation.
Not only has Vicky mentored and nurtured a huge cohort of young Aboriginal and Torres Strait Islander nurses and health workers and public health workers. That's the important stuff. You've not just nurtured and supported and assisted those in doing that, but you've actually nurtured me, and you've actually also nurtured all of us, Vicky, so I thank you profusely for that. And no award's actually going to be good enough to give you what you actually deserve for what you've done for that. And I look forward to what you're going to do with RHD.
I would now like to ask Vicky Wade to come forward and receive the 2019 Sidney Sachs Medal.
People of the lands we are gathering this evening. This land is sacred land with its ancestral, ancient ceremonial grounds containing bora rings, where once proud warriors celebrated ceremony, dance and law. I know my Noongar ancestors are dancing with the ancestors of the Turrbal people on these ancient ceremony grounds right now, and looking down on me tonight proudly as the first Aboriginal person to receive the Sidney Sachs Medal. I would like to dedicate this year's medal to all Aboriginal nurses who work tirelessly every day to influence the healthcare system to reduce inequity and disparities for their people. It is not easy being an Aboriginal person working in a predominantly white organisation built on complex hierarchical structures that often perpetuate the cruel racist policy against our people. Being a child from a mixed race, I had a black mum and a white dad. That was black nana, white nana. I learned from a very young age how to walk in the both worlds. I believe this has helped me in my health career. I can sit down quite comfortably with traditional owners, community, talk about cultural obligation, our rights, reciprocity, culture law and co-design. I can sit down equally comfortable with cardiologists, academics, bureaucrats and politicians and talk about clinical guidelines, research methodologies, health planning and redesign. It has not always been smooth sailing, however. When I was first notified that I had received this honour, thank you Andrew, I was saying, is Andrew playing a prank on me? I was a bit nervous, a little bit apprehensive and feeling, am I worthy enough? What it made me do though, it made me reflect on the last 43 years in health and look at what I have achieved. I started my nursing training in 1976 as a shy, awkward 17-year-old girl. The first month into my training, I was summoned to matron's office. Those nurses know what this means. As I entered matron's office, I was very nervous. Is your mum Joan Eggington the one that works in the local nursing home? Yes, I said in a low, shaky voice. Well, you won't finish your nursing, you people rarely do. End of conversation. I turned around and left the room, and as tears welled up in my eyes, I thought, yes, I will finish my nursing, I'll be a great nurse, and I'll do great things. I often thought which was the most powerful thing to make me want to survive, and sometimes I think it was it matron's cruel words, or was it my mother's voice in my head saying, be proud of who you are. The price you put upon your head will be the price others put upon your head. Both, I believe, kindled the fire in my belly, and it could be related to Newton's third law too. With this behind me, I started to recall all the great things I have achieved and contributions I have made, and I become less anxious and more self-assured, and I felt worthy and proud to be the recipient of the Sidney Sachs Award tonight. I tell these stories because they shape who we are. It's our lived experience, and they're important to the contributions that we make to the health system. In finishing, a quote from another great woman of the screen, Mae West. We only have one life, but that's all we need if we do it right. My life as a nurse manager, a policy maker, an academic, cultural advisor has been challenging, yet extremely, extremely rewarding. I have worked with amazing inspirational people, many in the room today. They have helped me achieve my goals. Those who know me know I'm not comfortable with the status quo. I acknowledge all my brothers and sisters, aunties and uncles. I also acknowledge the strong health advocates that have walked beside me and them. Please let's all walk together as equals to help close the ongoing insidious health gap for First Nations people of Australia for once and all. Thank you.